Well, um, I've never done this before, but I figured I'd give it a shot. So, and I feel like a lot of people are doing this now, especially with the discussions about autism and how many kids are being diagnosed. And I know there's a lot of different opinions about, why that is. My daughter was just diagnosed um, level 3, which is considered the highest level of needs and supports. But level 3 can look different. Level 2 can look different. Level 1 can look different for everybody. It's such a broad spectrum. But she's 4, and we have really, really struggled to understand how to parent her. And this is not the way I thought my parenting experience was going to go, but I mean, you never know how it's going to go. And apologies for the Dahmer glasses. Maybe if I clean them, that'll be less bad. No, it's still bad. Um, Again, autism, mom brain. I have. I forgot to order my contacts, so so I'm wearing these ugly glasses because I can't find the other ones that I have somewhere. Um, or maybe my child took them and threw them in the trash for no apparent reason. I'm not really sure. She likes to do stuff like that. So, but anyway, I don't know what I'm doing. And I just got back from the pediatrician by myself because taking my daughter places is kind of hard. So I had to go make an appointment in person to give them the papers. And now we have to fill out this thing called the Vanderbilt assessment, because not only does she have autism, she has ADHD. And to be completely honest, I haven't seen anything like it in my whole life. And I'm a teacher. I teach high school, but the lack of attention that she is able to, the amount of time that she's able to stay focused on something is so short, unless of course it's a tablet or like a TV show or something. But even then, she's stemming the whole time that she's on a device. I mean, she's very sensory seeking, and we're having a really hard time with refusals right now. Everything seems like it's no, which leads me to believe that she's also PDA profile, which is pathological demand avoidance. Again, I don't know what I'm talking about. I just Google all this stuff because I'm trying to figure this all out. But everything that we do with her has to be mapped out. And some days you don't really know what you're going to get. And the worst part of it is that you don't really know, like, is this a situation where I need to punish, or is this a situation that because of her neurodivergence, this is the way that she's reacting? And so finding the balance between, okay, parenting, or finding the balance between punishment and understanding that she's overwhelmed, and not trying to fuel those feelings that she's having. Because when you parent a neurotypical child, it's different. So, and honestly, if you had told me all this stuff 5 years ago before I had my daughter, I would have said that's not even a thing. Like, that's just poor parenting. Like, children will act the way that you teach them to act, and regardless of their issues. And I was so wrong. I mean, I didn't go around preaching this to people, but it's just something that I thought in my head. I was like, well, anytime I was out in public and saw a child screaming or, a kid rolling around on the ground, I thought, oh my God, that kid needs some, better parenting, right? No. Unfortunately, the parents in those situations were probably dealing with a meltdown from a neurodivergent child. Not saying that all tantrums are meltdowns, and not all not all meltdowns happen because you are neurodivergent or autistic or whatever. But my scope of understanding was very, very limited at the time, obviously because I didn't have a child, and that seems to be a trend. You don't know unless you're in the thick of it, and we're in the weeds, man. So we're dealing with that. I try to keep her on a schedule. It's hard though when she's ADHD because she just goes from one thing to another so quickly. It's really hard to keep her attention. And she'll be 5 soon, and we are still in pull-ups. And that is another thing that I have no idea what to do. I mean, it was weird because it was almost like she had a regression. So she was going pee-pee in the potty, and we were kind of getting there, and it felt like, we had sort of established a routine, and, she was willing to get up in the morning and go potty, TT anyway, not the poop thing. I mean, don't get me started on poop. I don't know when that's going to happen. And she will, when prompted, sometimes still go potty. But if she's wearing a pull-up, she really doesn't want to use the toilet because why would she, right? If you have that way of thinking, why would I use the toilet when I've got a toilet strapped to my butt, right? And, I get all this advice well, let her go bare bottom and blah, 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 blah. Well, she holds her poop, and if she's bare bottom in the house and she's holding her poop and the bowel movement is coming and she starts bouncing around on all the furniture, it leads to poop smears on stuff, and it's really, really gross. And so we tried undies. I mean, that kind of works, but then she'll just go poop in her undies. And so at least it's not getting on the furniture, but I'm having to throw away every single pair of undies that she wears pretty much. But yeah, daily routine stuff for her is hard. I mean, she's getting there. I mean, she's starting to understand. And part of that is probably my fault, because I'm probably doing things for her that I shouldn't be doing anymore. I'm probably enabling this in a way, but it's kind of hard to create teachable moments at 6 o'clock in the morning when you're trying to get off to school. She has to be at school at 7, and I have to be at school at 7:45. My husband has to be at work at 8. So, I don't really have the time in the morning to be well, let's learn how to tie our shoes. Let's learn how to brush our teeth properly without me having to dig in her mouth. It's all the things that, I guess a lot of people take for granted that are easy. Being a parent's not easy, no matter what kind of child you have, no matter what your situation. It's always hard. But there's some days where I just would give my left arm to not have my child struggle so much. And we're going to be starting ABA therapy soon, and I'm sure a lot of you guys know what that is. If anybody's listening, I'm really just recording this video because I kind of got tired of screaming into the void, and I don't really have a therapist. I have a therapist, but it's just for my meds, and I don't see her but every couple months or sometimes every 6 months. I take Prozac for my OCD and anxiety, and she just upped my dose because I'd been struggling lately. But I know this is kind of all over the place. I didn't really have a focus for what I wanted to say. It's just that I know that there are a lot of other people out there that are in this situation, and I guess it makes me feel not so alone to just kind of talk about this stuff, even if it's just to myself. And I see a lot of inspirational... I dropped the phone. Okay, I'm sorry. So I see a lot of inspirational people on online, and they're doing all sorts of cool like TikToks and, you know, cool videos and things like that. And I'm just really not that good at that kind of stuff. I'm more just record the video and see if anybody responds. But yeah, I guess I just wanted to connect with other people that are having these experiences, because I don't have any friends with neurodivergent children. And I work a lot. I know I'm a teacher, so I'm off right now. It's summer, but there's not really a break. Fortunately, we still have our child in daycare, so today I had to run some errands, and I've got to do a deep clean in the house, and my child is very hyperactive, and she just gets into everything, and so sometimes it's better just to send her to school so that I can get some things done. And I do that once or twice a week during the summertime, and the other 4 days, or the other 5 days of the week, she's with me and my husband. But I just can't get anything done when she's throwing pillows off the couch and jumping up and down everywhere and just stimming and emptying out my cutlery drawer. My daughter has a fixation on forks, knives, and spoons, like butter knives, soup spoons, and just forks, and like just the metal ones. She likes the weight. I think she'll go, when we get home, she'll go like directly to the drawer, and she'll pick out like which one feels good, and she'll just kind of we call it casting spells, because it kind of looks like she's casting spells, but she's stimming, and so she'll kind of make like noises like and wave it in front of her face and just kind of be on her tiptoes. And I know a lot of you guys have experienced this also. Everything for her is kind of backwards too. It's kind of funny. She likes to climb up slides. She likes to eat pizza upside down, like with the cheese facing the floor. So like the bread part is, well, it's all bread, but the non-cheese bread part is facing up, but she at least eats it with the pointy side going into her mouth rather than the flat side. What else? Oh, so one of the hardest things for me is trying to just not decide not to do things just because I'm worried about how my child's going to react. Sometimes it feels just easier just to say, hey, I'm just going to stay in the house for the rest of my life and not even go out. But I know that's not a viable option, and I know that that's not a realistic option. But even if she's not freaking out or melting, sometimes it's hard to deal with the stares and the whispers and stuff from other people, and I'm getting over that. It's just hard. So anytime I take her anywhere and we don't melt, I consider that a success, and we've recently discovered that she will keep the headphones on for like the little noise canceling ones for an extended period of time in certain situations. We recently took her to this Jurassic Quest thing that I saw online, and the whole time my husband and I were like, well, we're about to just spend all this money and she's going to spend 2 seconds in there and then have a melt and we're going to have to leave. But we were pleasantly surprised. She did great. She wore the headphones. She only got upset a couple times, but she made it through and she had a great day. So I've just resigned to the fact that, don't really know what I'm going into when I take her places. So recently we've been going to the park, and I think she's really enjoyed it. She doesn't play like with other children, but she runs and jumps and entertains herself. She does have some repetitive behaviors, so like she'll want to get on the swing, and it's the kind that kind of locks you in, and then she'll be like, okay, and then she'll want to get out, and then she wants to do that like over and over and over and over and over and over and over again. But then we have, times when we're out there when I can just sit on the bench and watch her, and she'll just run around and climb up the slide, but then she'll get fixated on something. Like the other day we were there, and I think autistic kids are drawn to places that they really shouldn't go. But there was a area of the playground that was kind of caution taped off, and they had tied rope around it, and you tell a neurotypical kid, don't touch that, they're probably going to be like, okay, I won't touch that. But my daughter was like, okay. So she is fascinated by tassels and things and stick object, anything that she can wave in front of her face she likes. So she found a piece of that caution tape, and she was just going to town, like yee. We call it yee. She yees. She just yee. And as her mom, who's used to this kind of behavior, I wasn't really fazed by it. And then I noticed another little girl picked up a piece, and her mom was like, no, don't touch that. You need to stop doing that. And I was thinking, do I need to correct my child? I mean, she's not hurting anybody. She's just doing her thing. And later on, that same little girl wanted to play with my daughter, and it was tough because I really wanted to see that happen and have that work out. But early struggles with the social stuff. And so the little girl and I were talking, and I said, well, my daughter doesn't really understand social cues very well. She's autistic. Do you know what that means? And the girl kind of shook her head, and I said, well, it just means her brain works a little differently from yours, and she struggles to talk, and she has issues with communication, and she doesn't really know, well, she's not really there yet where you are with playing and that kind of stuff. But I really do, you're more than welcome to try to get her attention and try to get her to play with you. She loves to run and jump, but it ended up being, of course, that the little girl said she doesn't want to play with me, and I said, well, I really appreciate you taking the time to try to interact with her and being kind to her. And it's not that she's ignoring you, really. It's just that her brain's a little different, and so she doesn't really see what she's supposed to, or not supposed to, but what you want her to do. She's just not there yet. So she looks, and the other thing is that she's really tall. My child's really tall. My husband is a very tall man. And so she's 4, but she wears like 7-year-old clothing. And so kids are really confused when they see her on the playground, and they think like, oh, a kid, we can play with her. She's like a big kid, and then they try to talk to her, and they realize that she's not like responding to their questions. She's not nonverbal. She just has a lot of echolalia, and she's a Gestalt language processor, and so she doesn't really have, she's not there yet as far as like abstract conversation. So I can ask her if she wants something to eat, chicken nuggets, whatever, and she can ask for things. She has spontaneous speech, but if it's like an abstract kind of question, like, what's your favorite color? She doesn't really know how to answer that question. She might repeat the question back to you, or she might, out of frustration of not understanding what I want, she might just say no and like run away. But every day is just, it's hard, and I guess I just wanted to get some things off my chest, and I'm going to continue to do this just to kind of keep my sanity, I guess. I feel better already now that I've kind of just talked about this stuff. And if anybody sees this again, I'm sorry about my glasses. I know they're awful. And hopefully next time I make a video, and if anybody sees it, I won't have these ugly things on my face. Anyway, yeah. Until next time, I'm sorry I'm not better at making cool videos. This is pretty much, if you're watching this, it's pretty much, this is where the bar is set for me. I, push record and talk. Don't have all the cool transitions and stuff. Don't even know if I'd have the patience for that. But anyway, thanks for listening. Until next time.